What was your first thoughts about AI when it actually implemented, and what is your thoughts now seeing AI and some of the things that it's doing, and not just in the beyond the front line care, but also on the back end of operations and revenue cycle and things like that?
I think everyone has a different take over their comfort level, their familiarity with it. When it
Hmm.
becomes real and you actually can get a solution that can scale, that is sustainable, right? That's secure in healthcare. We just can't implement anything over the way. We've got to be respecting people's data, their privacy, where all this is going, right? And that it still can be simple to use and it's accurate. Those are the areas that my mind goes around of how is this new technology going to actually work and can we actually afford it, right? In our area of healthcare, that post-acute care, non-acute care space, our funding is so very different and our margins are so different that it's a dream, it's a pipeline. You can see it, you can get excited over the potential, trying to help build that trust with others, especially when I'm talking with our CFO, or well, we need to be able to fund these things, we need to be able to invest in them, and they're probably going to fail. More are going to fail than are succeed, but we'll learn from it and we'll get
Yeah.
better along the way. That's different, right, than other people's take on what they can afford in their organization, what they can bring in and do. So for me, those areas of when I saw AI, my mind just becomes so open and excited over where it could go. And I think that seeking to understand and waiting, trying to find small wins. How do you find a win for someone? And you're going to explain to them that this may take over your workflow. This may take over the things you're doing. For some people, it's thrilling because I'm so overworked. Other people, now you're getting a bit personal. And now I'm getting scared and leery. So
Hmm.
building that trust for me, and that's where I think a lot of our challenges that we've had in healthcare, is it going to be safe and secure? Is it going to take over my job? Are the robots, going to be now taking over the world? What's it going to look like? I think I heard in one webinar that I was listening to fairly early on that AI will not replace caregivers or doctors, right? But a doctor or caregiver that uses AI will replace one that does not. That I
Yeah.
think is what resonated probably the most to me to try to help communicate and get others to understand. It's a tool. And then another great colleague of mine shared when the stethoscope came out, did it replace the doctor? No, but it was a tool for the doctor to use to provide better care for patients. That's what AI
Yeah.
means to me.
I um I love it. I think we're still in a space where a lot of people still have their guards up, and it's because they haven't got their hands in it yet. I think a lot of people that when they get their hands dirty and realize like, oh my God, this is actually really, really good, and just at the surface level, like a Copilot or a Chat GPT, that they would really see how this is of value to them. Kind of to what you just mentioned, that you heard something about the AI space. So I don't know if you're familiar with Gary Vee, but Gary says, when he started his career, he had someone following him with a camera, just filming his every day, and people thought that was crazy. But now there's so many people that have a camera guy that follow them around every single day, and he said that's exactly what's happening to the AI space. We'll have so much AI jobs out there, new jobs that are around AI, and the people that understand those jobs will get the jobs ideally. It's not that we're replacing jobs, but we're becoming more efficient. I love AI in the space of, and I was just doing this with my team. They were really in shock. Like I created these AI and automations on the back end that you drop something in one folder and it'll produce something in the other folder, and they're both looking at me like, "Oh, this is great." But it was also buying them back time. Not only is it buying me back time, but allows them to do more of the things that they love, right? You don't have to now do all these different things, go here, go here. It's done for you all at a click. So what I think though is that it's we're expecting our teams to adopt this. Why do you believe leaders need to use AI themselves before even having their teams adopt it?
Folks are looking at us as leaders and wanting to emulate, right? When they see us embracing change, embracing technology
Hmm.
to help us, not replace us, but to help us and do our jobs
Right.
better, it encourages, I think it inspires them to want to do their job better and find an easier way. And so for me, if we think we're too good to have to use Copilot to check our emails and revise it
Hmm.
for us, or it's not needed for me, but I want you guys for it to find ways. How is that setting an example? So, and it's a tool for all. It would have been crazy to think today, right, that Excel's only for the accountants. It's not for anyone else. I think getting that analogy out there might help folks too along the way embrace it.
No, for
That's just my
sure.
own thoughts. So, and
No, I love it.
it's different for everybody, right? It's a tool. So, how can we use these tools? And the only way we're going to be able to use them better and get that innovation out of them is by using them and learning, trying, piloting, learn from it. They're not all going to work, right? And that's about it.
I think people are very surprised when they start to tap into the space of, and I bring this up often, but I was speaking to a leader, and she was trying to create, she was paying someone to create her tone and brand. And I was like, well, you can use ChatGPT and create your own brand and tone and all these different things. And her response to me was like, no, Efrain, I'm not going to use it. Oh, I'm so against it. And so many people tried. It's like social media. She brought it back to social media. Everyone's on social media, right? So I pulled up ChatGPT and I'm showing her, like, look, I can take this and I ask her questions and I'm prompting because it's all about prompting, right? Good data. Keenan would say, my co-partner would say that trash in, trash out. But if you actually put in some good information, you're going to get some good stuff back that really surprises you. So for 5 minutes, I'm just showing her. 5 minutes later, she's sharing her screen and she's using it. And then a week later, she emails me and she says, Efrain, thank you so much. Like, I think I may be overusing this. And I'm like, there's no way you're overusing it. And I think it's just people are scared. People are scared. And that's just life. People don't like to get uncomfortable. And I think this is a place that we have to really get uncomfortable with and see the value within this tool, as you mentioned, because that's exactly what it is. And there's so many different tools, even on the back end. Like, we're talking about what's happening at the caregiver level. Do you have anything that you can talk about in the back end that people are very surprised could be utilized for?
Well, I want a quick comment back on what you did for showing the person their brand. What you did is you made it real for them. You showed them how it can help improve their life and made it a reality. That's what I think is going to be the most important area. So when we talk about the caregivers and you're asking me for examples of where it improved on the back end, is where you wanted to go with the question.
Yeah.
Looking at workflows, I think I'm going to weave it into that part of it. The workflow piece is what has to be incorporated. And if you can find a way to make a part of that workflow that's happening naturally today improve that person, improve the care they're giving, that's where I think it's going to be catching on. The notes, getting the data in the EMR, right? That's a part of the care plan for somebody, and to make sure that others can help take care of them. How do we bring both of those things together is where it's really going to take off and help us. So I'm not quite
Exciting
sure
time.
if I answered that
No, no,
question.
that
I
was
think I
it.
got carried away thinking about your experience with
No, I love it.
helping
AI
with
is such a
that.
fun topic,
It
and
is, isn't
I
it? It
love
gets your
that.
mind going in so many other areas. And I think the things we're struggling with today, we need to share those areas we're struggling, and be honest. It is not a perfect tool, right? How often do you even just ask Siri to do something, or you'll say Sheri, and Siri kicks in, along
Yep,
the way.
yep,
It
yep,
isn't perfect. Humans aren't perfect either. But
yep.
that's why I think with the humans and the technology together, we'll find the areas where that tool is going to be useful for us, right? And
Love
how
it.
do we make that tool better? And just look at all the new versions that are coming out, the different tools that are being built. Even today, is something, if I'm looking at for a caregiver, isn't going to be scalable to help all 1,000 because the dollar amount of the investment for that is just going to be overwhelming. Within time, because things are changing so fast, another 12 months, it may be a brand new tool that's a fraction of the price commodity wise, and it's even more improved to be more accurate and better. So you got to stay close to it, give it time, and work with it.